If you're a new mom and you just had your baby in the last 2 weeks, this message is for you. There's a lot of work in being a new mom, and I bet you're feeling this right now, especially if you're up in the middle of the night feeding your baby. So, a couple of things are happening to your body right now. One is you're getting a kind of dramatic hormone drop, and probably some of the adrenaline and the excitement of having the new baby has worn off and you're just tired. And that is completely normal. So, a couple of things that I would recommend to support you is to have your baby is going to be sleeping up to 18 hours a day in the first like 6 weeks of pregnancy or 6 weeks of being postpartum. And so, that we always tell our patients to try to rest when your baby is sleeping. So, try to get sleep when you can. We know that your sleep is interrupted because your baby may be eating every 2 to 3 hours, but we still need you to try to get rest. So that means taking a nap during the day. That means, for that 5 a.m. or 6 a.m. feeding, feed the baby and still stay in bed and go back to sleep because your health is also incredibly important right now. But one of the other things that's happening at around 2 weeks is there's really a very dramatic hormone drop from the pregnancy hormones, but it's a very dramatic hormone drop. And sometimes moms can get something called either postpartum blues or the beginnings of postpartum depression. Sleep deprivation is a big thing. Not eating when you're hungry, which is huge. So get lots of snacks and have that available. But if you're having some of those emotional feelings where you're not wanting to interact with your baby, you're not wanting to hold your baby. It could be it could be just a hormone shift. And so this is something that you should definitely contact your provider about. And they would love to talk to you through this and support you. When I have patients that are around this time, and they're feeling like very emotional and in some ways maybe detached from their baby, we bring them in, we do blood work, we make sure that they don't have an infection everywhere, we look at their bleeding, we really do a good evaluation of them, and then we help them get supportive services in place. And a lot of times that's asking family members for help, having people come over and visit, getting out in the sun, getting rest. So this is kind of a normal experience, but it's something that we want to help you with if you're feeling really, really emotional, like overly emotional at this point. So hang in there. It's going to get better. Every week, your baby changes, and every month, it gets a little easier. So we're going to keep supporting you through this.